It's Birth Trauma Awareness Week, impacting up to 45% of parents. Joining us is registered provisional psychologist and founder of the Reproductive and Perinatal Trauma Center, Teela Tomassetti. Good morning, Teela.
Good morning.
It's so good to see you again. And we're talking about birth trauma. How common is it?
It's so common. So as you just shared, it's in 1 in 3 and up to 45% of parents will experience that. And when we consider the partner's experience in that, it's about 25%.
Wow. So what are the long-term effects of this?
The long-term effects that people will see are those typical PTSD symptoms. So anywhere from like intrusive thoughts to flashbacks, nightmares, as well as sleep disturbances. But I also like to say it's a ripple effect. So it ends up hitting every part of their life. So relationship with baby, work, friendships, and like long-term impacts like physical pain and injuries.
Are there preventative measures for something like this?
Yeah, I think instinctually we all think that should lie with the person who is pregnant, but I like to think that it starts with prenatal education as well as in the OB's office and the midwives to talk about, hey, there is potential that this could take place, and if it does, these are the resources that are in place for you to work through it.
So then how do you help the helper?
Yeah, so I feel very passionate about this, and I've been lucky enough the last little bit to be going into Alberta hospitals to discuss it. So I actually think that preventable birth trauma, that 66% that they say, it lies with trauma-informed training for providers, as well as teaching them about compassion fatigue, burnout, and vicarious trauma. So if we take really good care of the provider, then we can prevent that preventable birth trauma.
Of course. So why is it important to draw attention and awareness to this?
Because when we do, we amplify their experiences and we help them to step outside of isolation and move towards healing.
And because you're so passionate, you've actually been doing something for the last year into a few of the hospitals around town. Can you tell us about this program?
Yes. So I've been going into hospitals to talk about trauma-informed care and training. So if providers are able to identify their own trauma responses, as well as the patients in front of them, then they're more likely to offer that compassionate care. But then again, it goes back to how do we take care of them so that they're not kind of spilling some of their own experiences onto that patient. Which ends up resulting in improper care.
So you've been doing this for a year now. What are people saying to you after you've told them about this?
The response is so huge, and which has been such a relief to me because that preventative aspect is something I'm so passionate about. And so to hear hospitals in Alberta stepping forward to say, like, we want to learn more about this experience and how we can do better as providers.
Well, Teela, thank you very much for the information. Once again, it is Birth Trauma Awareness Week, impacting up to 45% of parents. Thank you for coming in. You can have, if you need more information, you can visit reproductiveperinataltraumacenter.com.